Hi, this is Charles Au, and welcome to my presentation on stem cells, the dawn of a new age of medicine. I'm very excited to present this to you, and this is for the benefit of many people who have missed my talks in live person. This talk will last approximately 50 to 60 minutes, and with about 101 slides. I will, however, skip through the first part quite quickly, and you can always skip back or skip forward to the parts that you're interested in. So the first part will cover the actual commercial landscape with regards to this industry, the disruptive breakthroughs of this technology, the research milestones. Then we address the questions of why stem cells are important, why we need them, the types of stem cells, and what is the safest form and most efficient form of stem cell therapy. The process and proprietary enhancements, and the fun part where with all the pictures is the case studies and testimonials that you will see at the end of the slide. Okay, so without much further ado, thank you for attending this presentation, and let us begin. Currently, people are thinking, well, stem cells are still in the realm of theory. It is. I'm here to tell you that it is not, and it is very real, and there are over 350 adult stem cell companies around the world and growing rapidly. Many of them are in different areas. Neostem stem cells, Cytori manufactures machinery to harvest and process stem cells. Market value is significant, but small compared to major pharmaceuticals, but they are growing very, very quickly. You can take a look at Geron, which is $600 million market cap company. We have adult stem cells in bone repair. We have adult stem cells for liver repair. We have adult stem cells for nerve repair, and with the largest one being Osiris Therapeutics at almost $500 million. They have a few products, their own cultured stem cell lines, which is in phase 2 and phase 3, and we expect them to get FDA approval fairly soon. These companies are using a pharmaceutical model whereby they use their own stem cell lines. They culture, proliferate, multiply, reprogram them to act in a specific way for specific organ systems or cell structures. This is the reason why they need to go through FDA approval to ensure safety from the application. You will see later that the safest form does not require any multiplication. And it does not require any reprogramming, and it is not regulated by the FDA, and therapeutic dose is very, very high. And this is this will show this to you in the later part of the talk. Okay, so the major paradigm shift in thinking, or a new dawn of a new age of medicine, is conventionally what we had, or in current medicine. We medicated our symptoms and issues. The truth is, today, if we can regenerate, we actually don't need to medicate. So current medicine uses drugs in its first stage to interfere and inhibit our own unique biochemistry, such as proton pump inhibitors, beta blockers, selective serotonin reuptake inhibitors, etc. If that doesn't work, they tend to remove or replace organ systems, hormones, or they destroy using radiation and chemotherapy. Whereas the future of medicine is moving towards regeneration, renewing, repairing, revitalizing, reversing, remedy, and this is what we call true healing. That's the evolution, which is actually what we call almost a revolution. So I believe that this is an idea whose time has come, and we should definitely take a look at this, because the stem cell industry is no older than 8 years old as of 2013, and it's not going anywhere, and it's only moving forward with amazing advances happening every day all over the world. This is what we call personalized longevity. Remember that medicines are not differentiated, which means they do not take into account the bio-individual. It is not one pill for every ill. This is last century's medicine. Today, the more intelligent way to true health, rather than sick care, what we're talking about true health care, is to discover and understand your own unique biochemistry, who you are as a bio-individual, so that we can better predict your current situation and whether or not you will develop a disease in the future, or how likely you are to develop a disease, your predispositions from, say, genetics or current health assessments, so that then we can personalize the specific protocols which are unique to you, which would more likely have a better clinical result. Therefore, providing you the custom or tailored nutrition or recommendations from diet, lifestyle, etc., so that you can more effectively prevent a disease from happening in the first place. Now remember, many supplements and supportive nutrients work to protect, such as antioxidants for free radicals, to repair, such as Silymarin for, say, liver repair, etc. But very few things on the market today actually help regenerate your internal organs. And this is something which is innate in our own bodies. What we have to do is learn how to reactivate that to promote regeneration and healing from the inside. Looking from the road from evolution to revolution. This is extracted from Lehman Brothers, and you can see throughout the last 100 years or so, many big jumps in the discoveries in modern medicine have taken place, from penicillin, which actually happened by chance, through to psychotropics, through to non-steroidal anti-inflammatory drugs, to beta blockers for heart issues, to statins for lipid lowering, to biotech drugs, and then we're moving towards molecular biology, cellular pharmacology, genomics and proteomics, as well as even viral medicine, genetics and viruses working together to, for example, regenerate pacemaker cells in the heart has actually been done in mice successfully. And now the new jump, which you actually don't really see here, is actually stem cells. And that promises to revolutionize the entire industry. And it is already working right now. And so it's something to watch for. I believe this is not just the third generation, but it is the fourth generation of medicine. Just a couple of weeks ago, in December 2012, the Chinese have actually successfully taken skin cells from urine and turned them into brain cells, neurons, so to speak. So phenomenal stuff happening all around the world, and quite promising as well. Don't forget Shinya Yamanaka and John Gordon, who won the Nobel Science Prize for turning any adult cell into a pluripotent adult stem cell. So this has been proven to be effective, and it does work, and it is real. Why is stem cell important? Because of the aging population, because of the baby boomers. You're looking at, just in the American statistics alone, 1.4 million Americans are in their 90s, and another 64,000 are over 100 years or older, and they represent 30% of the US population. And we're living longer, but not necessarily healthier. And so by 2030, 20% of the US population will be 65 years of age. Many of the drug development are in the area of, as you can see, Alzheimer's and dementia, diabetes, metabolic issues, lung respiratory conditions, eye and GI tract conditions, from osteoporosis, pain, rheumatoid arthritis, etc. So the issue is that as we get older, we're going to have more problems, and chronic diseases account for 75% of all healthcare expenditures. and the costs are approaching 1 trillion just in the US alone. So these expenditures are not delivering what is possible, and we cannot afford this. So right now, if we can make the older generation healthier, then we could significantly reduce the stress on our national healthcare system around the world. And this is very important. So right now, this is not science anymore. It is actually not science fiction, but it's actually reality today. If you looked and did some research, you will find over 2,500 clinical trials using adult stem cells underway just in the United States alone. But this is happening all over the world, and you have many products actually in from phase 1 to phase 3 and about to get FDA approval, so definitely watch this space. Some of the major clinics that are using cellular therapy right now is from Johns Hopkins Mayo Clinic, as well as the Texas and Arizona Heart Institutes. Some major hospitals there are already applying cellular therapy. In Asia, China is actually very, very big in this front. Actually took a big jump in research, success, and development after during the Bush era when Bush actually banned most of the stem cell research because of the far right opposition to this industry. And that set them back quite a bit, and now they realize that they cannot move forward and they cannot lose the opportunity in this industry, and so everyone is now putting a lot of effort into stem cell research. So China's, as you can see, are dealing with had a lot of success with ALS, MS, stroke, etc., even autism as well. Singapore, Malaysia too has a very big research interest in this area. Thailand for diabetes, and in Thailand you are seeing the Bangkok Hospital, the Phaythai, Param 9, Chao Phraya, some of the hospitals which pioneered adult stem cells for heart disease with success. And you will see later on a CBS announcement on the success they had in America with this as well. So take a look at developments globally. If you sign up for Google Alerts, in just 1 week you can see the announcements on stem cell successes, from diabetes, from winning the Battle of the Bulge, losing weight, helping with gangrene and preventing leg amputations, treating stroke patients, injecting into the heart, actually stopping chronic chest pain. We'll see more of that later. And from gray hair to actually reversing clogged arteries to MS sufferers, heart attack patients, as well as brain cells and improving neurodegenerative issues. A lot of vets are starting to use this now, especially for racehorses, etc. Diabetic patients, macular degeneration, advancing cosmetic surgery, such as a facelift without resection, by strengthening and toning muscles. Even Botox is not necessary now. Instead of using something to paralyze the muscles in the face, you actually strengthen the muscles and to tighten it. And that's actually what if you were younger, that's what your skin and muscle would do. So everything from using fat to repair skull defects, joint replacements. Recently, if you've read, Johnson & Johnson had to recall over 90,000 hip replacements, with 8,000 lawsuits pending. So there's a major issue with that failing and actually leaching chromium and other metals into the bloodstream, and actually just breaking down faster than they expected. So even the Vatican, I found this very interesting, even the Vatican has launched a stem cell venture with the US company. I guess we have to keep the Pope alive for as long as possible. Okay, so the future, I think this is underestimating it a little bit, and you can see it growing rapidly. So for those who are interested in the business itself, do take a look at this space as well, one of the fastest growing sectors in medicine. So why do we need stem cells? It's a part of our natural aging process. Stem cells for. As a child, we have about 80 million circulating stem cells. and that's why we heal faster when we twist an ankle, etc., or break a bone, God forbid. But it does happen, and as we get older, around the age of 40, it starts to dip quite quickly. You start to notice that many people start having issues when they reach the age of 40 and above. And if we hurt ourselves, it just takes longer to heal, and it doesn't heal completely as well. So older people have less stem cells. At the age of 40, we have less than half of the circulating stem cells in our blood. By using stem cell therapy, we can literally turn back the clock by boosting our stem cell counts in the body to help regenerate and repair organ systems. Okay, so this is very important. So the next we jump into what are stem cells. We have, of course, everyone talked about this a couple of years ago, as embryonic stem cells, which have moral and ethical issues in terms of how they are actually sourced. They are actually totipotent, sometimes a little bit too powerful, in the sense that there are some concerns in what else it can become, what else it can grow into. And that is why a lot of this is embryonic stem cells are actually controlled. And what happened was, because of the big hoo-ha and the moral and ethical issues, most of the research started investing into adult stem cell, where it's free from the ethical and moral concerns. And these are also multi and pluripotent. Many technologies are working to reprogram these cells to turn them to specific organ cell types. A lot of it's still in its experimental phases now, but they have had some successes. They haven't had many human trials, but it is moving in that direction, and they will figure this out sooner or later. And you do also have progenitor cells, which are what we call unipotent, which means they tend to turn to one or two cell types. But most of the research therapies are actually in the adult stem cell regions. This is where we're going to focus our time on today. So there are different types of stem cell sources, from the fetal stem cells, which come from the embryo, the umbilical, and the placental. This is where it's very contentious. The adult stem cells come from bone marrow, which has been used for over 2 decades, I believe, to treating leukemia patients, where they use radiotherapy to destroy the immune system and extracting the stem cells prior and then re-injecting it back into the bone marrow to repopulate those blood-producing cells. So that we know is safe and effective, but extraction from bone marrow is very painful. There are now T stem cell banks as well, and baby tooth stem cells can be purchased and used as well. Adipose tissue, of course, is now one of the most popular ways of extracting autologous stem cells, because it tends to have the largest number. Peripheral blood is also important, but we will see that we don't get many stem cells, and therefore they have to go through a multiplication or a cultivation phase. Muscle, brain, blood vessels, liver, and skin. It's just very difficult to get it from these sources, and you would need to do a biopsy for muscle and other organ systems as well, and then you have to grow them to sufficient numbers to use them. So right in the moment, these are the two viable, most viable, besides bone marrow, places where we can extract stem cells. So looking down from previously in Switzerland, in Montreux, Switzerland, La Prairie was offering the service to inject what we call xenotransplantation, or live cells from sheep. And there's not much research on this. It typically costs between $20,000 to $30,000 US, and believe it or not, there's a waiting list. I have met people who swear by it and have seen real life results from this, but don't forget, it is of animal origin, and it's not from self. So autoimmune reactions can and sometimes do happen. They are rarely life-threatening, but still, we'd like to avoid that issue. And today we're moving towards autologous cells. Fetal cord blood placenta, they are very potent, but they come with the stigma of the contentious issues of moral and ethical concerns. So right now, everyone is looking at the autologous or human-originated stem cells, and these have a lot of peer-reviewed. There's a lot of research and many trials to verify the efficacy and safety of these stem cells. Okay, what we're looking at is adipose stem cells, and I'll tell you why. The reason is because adipose can contain over 2,000 times more stem cells than bone marrow itself, and most people have a little bit of fat they want to get rid of. They can actually use that fat for facial dermal fillers, so there's an additional benefit. Some people who have enough can even use it for breast enhancement without silicone, which you'll see later, which is quite incredible. And it basically has also a lot of other progenitor cells and growth factors locked inside adipose tissue, which are also very useful in the overall healing process. So bone marrow traditionally is a very painful extraction process, and you don't get as much as you do from adipose. And the reason is because of this. Besides the painless extraction process compared to bone marrow, you also get a lot more stem cells per unit volume. There is no incubation period, which typically takes anywhere from 4 to 6 weeks. I have heard of new technologies now, requiring only a week to multiply and cultivate. But there's always a question of a loss of viability and also concerns from DNA damage from multiplication and expansion. This is why adipose is still preferred, because there is no you don't add any drugs or synthetic chemicals to it. It's all done within one procedure, and therefore deemed safe by the FDA. There are no moral ethical issues, and nothing synthetic added as well. So this is the safest stem cell procedure possible, with no concern of autoimmune reactions, because it is already inside your body. It is just extracted, activated, and re-injected either through IV or local injections if you have, say, a knee, back, or a shoulder injury. Okay, so let's take a look at the regulatory clauses so we know what the authorities say. The Australian TGA says no regulation for the use of human cell tissue and cellular tissue-based products that are removed and reimplanted in the same patient in a single surgical procedure. The US FDA also says the same thing, so it is exempt if you remove and reimplant tissue in the same patient in a single procedure as well. Even the Canadian one regulation says it is regulated unless the research involves autologous donation, which means self. One of the many questions we get is, how does a stem cell know where to go? Usually during a site of injury or inflammation, there's a lower level of oxygen, which we call hypoxia. There are things like stromal-derived factors, humoral growth factors, and platelets, and other signaling molecules which will actually attract the stem cells to that area to say, okay, this is where I need to do my work. So looking at where typically your stem cells like to go, your lungs tends to be the place where it likes to migrate, and that's why we see great results for people with COPD, emphysema, etc. as well. The spleen, so immunity, pancreas, the kidneys, from the brain, liver, heart, and muscle as well. So this is where these stem cells actually tend to go to in terms of the numbers. This is a slice of a rat's heart, and stem cells were actually dyed to track their migration, and you can see that it actually goes to the spaces where there is actual damage in the heart. So it actually knows where to go to do its repair work. This is a man with a contracted right hand, couldn't open it, with also bladder, prostate, and probably liver issues as well. You can see most of the stem cells tend to go around the lungs, as well as on his right hand here. And you can actually see this quite clearly and how it's improved. Okay, so there are many different cell types that stem cells can help repair. And we look at the stem cells as the conductor in the orchestra. Don't forget, you require all the other growth factors around the violinist, the cellist, the pianist, etc., to actually do the repair work in concert. So this is the technique and the process. Very simple. We harvest up to about 200 cc's taken from your from the belly area. It is then separated. Fat cells are separated. They are then activated, and then we use it to treat. That's in a simple form. We're going to go into details, and we'll show you real pictures of real people going through this procedure. Any excess, because adipose stem cells provide so much stem cells, that we can typically bank them for future use as well, enough for 3 to 4 additional treatments. Therapeutic dose for adipose, autologous adipose-derived stem cells, about 40 to 50 million stem cells. And we typically collect 400 to 600 million from a patient, but with our stem cell boosting procedure, we have seen people over 1 billion to as high as 2.4 billion stem cells, and we typically use about 100 million for treatment. So it's a very simple 3-hour outpatient procedure, which is fast and safe. You don't go through general anesthesia, just some sleeping pills and local anesthetics like lidocaine and epinephrine in the area where they do a fat extraction. It is not really a full lipo. It's not quite as violent as the liposuction. It's a fat extraction. No suction machines are used just as a precaution, because they don't want to damage the stem cells. So that is fat harvesting or fat extraction. We can then break down that fat using a proprietary product, which we'll go into a little bit later. We separate that using a centrifuge. And then we can bank the additional cells that are not used in that treatment that day for future use. We then activate what we get, mix it back with the growth factors, PRP, which is platelet-rich plasma, and full spectrum LED, or low-level laser. And then we infuse them via an IV drip, or implant them, or inject locally. So here's what happens when a person is lying down preparing for their mini fat extraction. We take some blood from them, and this is the reason why we take the blood, is because inside the blood we have over 478 protein sequences and growth factors, everything from helping with your blood sugar control, to antibacterial proteins, to inflammation control, to bone stimulating factors, to transporting hormones in the blood, etc. and etc. If you can just take a look at it, it truly is an orchestra of components here, and stem cells help to orchestrate all this together in concert to elicit that healing or regeneration response. So pretty amazing. So this, if you're going to go through a stem cell therapy, make sure that they use this holistic approach. Okay. So if you do get a cut on your skin of your surface, you can just see how many things are going on, where you have vasoendothelial growth factors, platelet-derived growth factors, fibroblast growth factors, etc., all working with immune systems and macrophages and neutrophils, all working in concert to heal that cut. So a little bit of blood's taken, and that is centrifuged out, and you can see the growth factors are all in this fraction right up here. That is then extracted so that we can remix step into the stem cells. No drugs, synthetic drugs are added. The only thing is calcium chloride is added to clot the blood, any free floating blood, so that there is no clotting on during the re-injection. This gentleman here is actually holding it to warm it up because blood actually clots at your body temperature. So he holds it for about 10 minutes. And this is what happens. You can actually see it coagulating and clotting on the side there. While that's happening in the technician room and processing that, we are finishing up with the fat extraction. And as you can see, the top part, the orange, the light orange part on the top here, that's your fat, which will start to rise. The bottom part's the tumescence, which is lidocaine and epinephrine and saline. That's poured out, and the fat fraction is then put in and collected into the bag. If you take a look at the cannula here, it's a very interesting and very simple and very effective too. That goes at the end of a syringe. The surgeon here, this is the plastic surgeon, has done over about 500 lipos a year. He basically pulls it out, forms a vacuum. The syringe is locked into place, and that cannula over here maintains a 0.5 psi constant draw, which basically gently extracts the fat cells from your body without damaging the stem cells. The fat then typically rises to the top, floats to the top, and we drain off any of the free-floating, any of the remaining tumescence. It is then re-washed and re-rinsed with sterile saline, and the process goes through a couple of times until it's clean. And here's where the magic happens, and where we add a phospholipid. Now, most people around the world have been using collagenase. That technique was pioneered by the University of Minnesota. However, the doctors have now postulated that collagenase as an enzyme may also affect stem cells by degrading the cell walls and therefore affecting actual viability itself. So now a far more gentle way of extracting it without damaging cell walls uses a combination of phospholipids. Other extraction methods uses ultrasound as well. So those are the two main methods for now extracting stem cells safely. If you actually could look closer, you can actually see some furrows happening here where the stem cells actually are falling into this fraction here. They then draw out that fraction, okay, and they basically spin that out, and you can see the beginnings, the collection of the stem cells at the bottom. It is then rinsed and cleaned and spun again, and you can see that the stem cells, the magic all happens here. So it looks like a lot, very little for so much trouble, but don't forget we all started as a single cell as well. So don't judge the book by its cover, and in this case size is not all that matters. So here's something also very different that we use. There is something that's often ignored. The activation of the stem cells. LED light is actually passed through the samples for about 20 minutes to actually wake them up and activate them. So although you can boost stem cells in the body, activation is another consideration. So we had some questions being asked saying, does it work, etc. We'll address that, and why do you need light and what frequencies. So after it's activated, it will be put into your saline drip, and that goes in through IV into the body, or injected locally to areas of damage or injury. Now going back to LED activation. Stem cells are primarily dormant, but we do notice that various frequencies of light activate or wake them up. They basically energize them into action. Currently, low-level LED is used for wound healing, anti-inflammatory issues, high-powered cold lasers, which are FDA approved for pain and inflammation. They increase blood flow, which is why some machines are being sold to actually stimulate hair growth. It's helped with scarring and wrinkles, and anti-infective infrablue for anti-pathogenic bactericidal effects like the blue lights in hospital, and also like UV lights used to help with people with psoriasis. So light seems to make things work, wake things up, and activate things, just like plants and light. And even human beings, we need light too. Oops, here we go. And just to look at the research data on this, you will see that over 160 evidence studies to date using stem cells, so using light to activate stem cells. Light activation, we ran the tests from different frequencies of light from infrared, yellow, red, and green. We found out that when we mixed green, yellow, and red together, we get the most activity. So full spectrum is what we're going to go with. As you can see, incubating the stem cells, we actually have a 50% viability per gram of fat compared to a 90% viability per gram of fat. In fact, so far all our patients have above 90% viability through our test after activation. As you can see, the stem cell colonies with the PRP and LED activation is far more active than the non-activated stem cell colonies. So if you're going to go through a stem cell therapy, make sure that the people doing this are using an activation technology which is proven, because you don't want to go through all that effort and not maximize the results. Okay, so in summary, what you're looking at is after the extraction of dormant stem cells from adipose tissue, you will have to add in your bioactive mediators, all the growth factors and the progenitor cells which are extracted from the blood. You will need an activation technology, either LED or ultrasound, that activates them and that have been proven to be more viable through this activation method. And now we get the activated cell, which is then actually now reimplanted, re-injected into your body, so that they're more likely to work and they're more effective and more viable. Okay. So this is used, as we know, topically also for cosmetics, wound healing, or orthopedic issues, or directly into the bloodstream itself. So the excess fat can be used as fat fillers to fill in laugh lines and wrinkles, etc. And they are more permanent than normal fillers because the stem cells actually regrow the blood vessels to fix in the fat fillers permanently. Some of the case studies we had from 5 years ago with these numbers have actually increased quite a bit, and you can see you know, a benefit in almost every single one. Parkinson's, we had less success, 2 out of 5 with benefit, but I believe we needed a little bit more of holistic and adjunctive therapies to make that work even better. However, everything from chronic fatigue and wound healing is actually very, very effective. Currently, stem cell cases that we've done include everything from Alzheimer's, from Parkinson's, to rheumatoid, diabetes type 2, joint pain, allergy, ataxia, migraines, colitis, memory loss, even sexual dysfunction. Stem cells are being injected directly into corpus callosum of the penis to improve function. Acne, IVF, increasing implantation success rates by double to over 60%. Great results on stroke and liver disease and all breathing issues, as well as heart conditions as well, joint pain, back injuries, etc. So for those who you know, want to actually do a little bit more research on how real this is, you can simply go to YouTube, and these are just extracts. Just type in stem cells and any disease name you're interested in, and you will find results. And these are just the number of videos that people have posted. Many people have not posted videos. You can see many testimonials, real-life testimonials from people all around the world, as well as lectures, etc. On the therapies. For COPD as well, for breathing conditions. We have for stem cells and diabetes over 1,200 results. Of course, you shouldn't just rely on stem cells for the cure. You really would do yourself a favor if you improved your diet as well as supportive supplementation to help improve the overall outcome. So together we believe that diabetes can be reversed in many cases. Now they're working even on type 1 as well, and insulin resistance starts to improve in type 2 at the same time. Stem cells and Alzheimer's. Many people improving mental function. Even people who don't have Alzheimer's after the treatment feel like, if you've watched the film Limitless, much greater mental clarity, function, memory, as well as mood improves. I've even met people with chronic depression cured. Arthritis, over 1,000 results, and now you will see in the next slide that it's actually recognized and it's very, very successful, and how many people have actually had their lives improve dramatically with this. If you can see from the International Archives of Medicine, stem cell therapy in the form of autologous stromal vascular fraction is an accepted therapeutic modality for degenerative conditions with 80% improvement and no serious associated adverse events reported. Conventional therapy only gets you 50%. So now we do know this is working well in real people and not just in animal studies. Not too long ago, stem cells have been used to regenerate a damaged heart. You can actually watch this video on CBS itself. And this is Cedars-Sinai actually helped pioneer this technique. And it's very, very exciting itself, and actually helping people with like 98% blockage in their hearts, actually making a huge difference. So do take a look at this. A landmark case study for spinal cord injury. Jerry Allen of Florida stepped out of his wheelchair for the first time, but this was done in China. They actually did use embryonic stem cells and reprogram neuronal cells, and you can watch him on YouTube as well and track his entire journey. So this is a reality today, and Christopher Reeve's Superman was right. It's a shame that he did not get to see it, but his work and his efforts in this area have made a big difference, especially to Jerry. This is a 14-year-old child with cerebral palsy, and you can see the improvements made, and that's where the stem cell, that's where they tagged it, and the gold portion there is where the stem cells migrated through the blood-brain barrier inside the brain and to elicit healing. You can see where there's a halo effect right here. That's where the stem cells are actually congregated in a cerebellar atrophy patient. You can see here a diabetic foot in 8 days cured. Diabetic ulcers are notoriously difficult to heal. This woman suffered from an acid burn attack on the face, and without any surgery, you can see how it started to resolve all those issues, and the melasma and the discoloration, the melanin actually started to even out as well. Here is a fat filler using a stem cell facelift. So after the therapy, the woman was also given fat filler with stem cells in the laugh lines and an IV drip, and you can see collagen and the discoloration on the side of the face slightly improve as well. Eyes slightly lifted, and improving even on the neck here as well. And this gentleman here as well, you can see his turkey neck being reduced by increasing the metabolic function in this area right here. That's a significant difference. Madonna uses this technique as well, and now the new way of facial rejuvenation or aesthetics is not sticking in fillers and Botox and silicone implants to look like a blow-up doll or looking like you have a dead face but smooth. It's all about looking younger, looking naturally younger, and not looking different. So this is the trend right now, and I think it's a much better trend. In fact, we see stem cells as actually natural medicine because there is no actual chemicals added to it. We're going to watch this quickly. This is to show that it is in commercial landscape, and surgeons are now using this and doing this process in Beverly Hills.
Life Changers, look 10 years younger with the help of your belly fat. In tonight's Life Changers, why your belly fat is the new anti-aging secret. Tonight's Life Changer has a new procedure that definitely got my attention. He's using women's fat to make them look years younger. Cells taken from belly fat, making the old school facelift obsolete.
This is probably the answer that we've been looking for a long time.
That's right, Dr. Renato Calabria may have finally found the fountain of youth.
This is a major breakthrough in plastic surgery.
Regenerative cells taken from our own bodies that can erase the signs of aging.
They jumpstart the rejuvenating phase.
The revolutionary procedure, the stem cell enhanced facelift. Okay, here's how it works. Fat is removed from a patient's lower abdomen. Stem cells are then separated from the fat cells and injected into the patient's face. There, the cells rejuvenate the skin and improve its texture.
The traditional facelift is pulling skin in the wrong direction. This facelift is more a volume replacement facelift.
What about the controversies surrounding stem cells?
The sub-controversial one are embryonic stem cells. These are adult stem cells. They are present already in our body, so there's no controversy.
How long will this type of facelift last?
The stem cell has a potential to continue to rejuvenate for a long time. It's premature to say, but again, I think is the way of the future.
That future is now.
That future is now. Other doctors that pioneered acne scarring, long-term acne scarring issues, Dr. Zia Ceylan. And you can see this woman 10 months after treatments. You can see significant improvements in her acne treatment. This is a prominent lawyer in Korea. He had only stem cell injection via IV only. And as you can see, collagen and fullness, elastin, etc. Improved quite a bit. And even his hair, which is not dyed, and his eyebrows actually started to darken. And we really like this photo because his expression is exactly the same. It's actually what we want from all our photos. This gentleman also had issues with his thumb, peeling skin from his thumb for many years with no resolution. Stem cells were injected under the thumb, and you can see that improved. He was actually very pleased with that result. Some women in Korea wanting a more feminine face, using the stem cell filler, as you can see. For another lady as well, giving her cheeks, and also a very good response, as you can see here as well. And this is a pretty significant difference for this lady down here, even including the neck, as you can see. It's a major rejuvenation here. Incredible amounts in the lines and the laugh lines, etc., and lines around the eyes, and skin texture overall. We also are now looking at natural breast augmentation without silicone. Again, the same process, but re-injecting it into the breast. And what happens is that the stem cells itself stimulate blood supply, vasoendothelial growth factors, to attach that fat for a long-term effect. So as you can see, although it takes a year and a half, you can see the very natural progression of the breast enhancement, which is now the preferred way for some women to go. Balding is now a thing of the past. There is a clinic in Rome in Italy which charges about $25,000 US to do this, but they have incredible success rates. You can see this gentleman here with no hair. There is some amount of implantation because you do need to seed the area with the information for the stem cells to work on. But once you've done that and you inject the stem cells, you can see after 8 months he has a full and very natural head of hair. Our techniques have been taught to Dr. Richard Allen Bogan, which uses this now in his surgery. He's a very, very famous Beverly Hills doctor. Ask anybody in Beverly Hills and they would know of Richard Allen Bogan. These are some of the other clinics around the world, including one of the top vets that use this our techniques to help animals and horses. And finally, in the last 2 slides, just to highlight the journey. Regenetech, this is our stem cell journey. We first assess your unique biology, so we can understand how your body's functioning right now at this moment, and if required, we cleanse, build, and optimize your body before we boost your stem cell counts. If you're healthy enough, we can just go straight to the stem cell boosting phase, which takes anywhere from a week to a month, and then prep you for the autologous adipose stem cell therapy. Here are some of the just a few of the clinically proven and studied stem cell boosting ingredients. One of the major ones is actually blue-green algae from Klamath Lake, specific a species called Phanizomenon floss aquae, cordyceps, as well as, you know, that's a Chinese mushroom. All the immune boosting mushrooms, Photo Polygonum multiforum is also a herb, Chinese herb, ellagic acid and berries, and this actually helps with also immunity. Stilbene from grapes and blueberries. Glutamine is one of the most abundant amino acids in the body, also stimulates stem cells, but it's also great to prime the person with glutamine for GI tract improvement as well as wound healing before the treatment and also after. Astragalus is also used for boosting immune system, and epigallocatechin gallate 3 is the clinically studied one from green tea to improve also stem cell counts. Vitamin D3, the most effective form, is through liquid drops where you can get 1,000, 5,000, 10,000 IU per drop. We have a repeat of astragalus here, and Lactobacillus fermentum as well. You will notice that many of these are actual immune boosting or immune supporting nutrients. So that's something quite interesting as an association. There is also a product that we use prior to that, and the main ingredient, the floss aquae. We are using StemTech and as well as some other supplements to a proprietary formulation to boost stem cell counts prior to extraction, so you get the most out of your therapy. This is the reason why we chose this is because it's the world's first and only patented, scientifically proven stem cell enhancer. And so we take a very responsible approach before this therapy. And so if you do have any questions on this whole process, I'd like to thank you all very, very much for your time and patience. And if you have any specific questions, you can contact me at charles.au@regenetech.com or Facebook me at charlesau, and I'll be more than happy to answer any and all of your questions. So thank you all very, very much once again, and do contact me if you have any questions. Thank you.